Okay, so 10:07. So let's start. So we'll not wait already for the others, and hopefully they can catch up. Okay, so last time I have been discussing with you about what? Antiviral. Am I correct? No. Okay, so last time I think I have been discussing to you about drugs affecting the immune system and drugs which are used to treat cancer. And also, in my first lecture with you on pharmacology, I have discussed about antibiotics, correct? So we have discussed about the antibiotics that is affecting the cell wall. So now we are going to discuss the antibiotics that is affecting protein synthesis. Okay, so protein is very important for the cells. They are very much needed for the cells to develop. So without protein, these cells or these bacteria may die. So this is where these antibiotics will be acting. So because of it impairs the protein synthesis, then these microorganisms or these bacteria will die. Oh, something's wrong with me. Okay, so I think it's okay. Okay, so we are going to discuss today about the antibiotics affecting the protein synthesis. So the first one is gentamicin. So gentamicin, let's start immediately with the pharmacotherapeutics. So these are useful in serious conditions of the urinary tract, or it means any infections in the or any urinary tract infections which has a serious form. These are the medications that we are going. This is gentamicin is the medication that is preferred to treat these infections. So normally males don't usually have urinary tract infections, because if a male will be infected with will be infected in the urinary tract, it means it is a serious infection. But for females, usually on average, they will have at least maybe 2 or 3 infections in a year. So that is related to the related to the urethra. Okay, so it's longer for males and it's a little bit shorter for females, and it poses them a great risk for urinary tract infections. And these urinary tract infections, sometimes they are easily treated with antibiotics. However, if there will be a problem on the antibiotics or on the medications, then it may lead to serious complications such as the following here. We have pyelonephritis, so it will be affecting already the kidneys. Gynecological infections, so this is for women, it will already affect the other parts of the reproductive system. It may also lead to peritonitis, endocarditis, pneumonia, bacteremia, and sepsis. So gentamicin is also useful in respiratory infections, including those associated with cystic fibrosis, osteomyelitis, and foot and other tissue infections associated with diabetes. Okay, so for gentamicin, it is not a first line of it is not the first line of antibiotics that we are going to use. So these are already for the more serious infections. So usually we will start with the basic antibiotics like what we have discussed last time. But for serious infections, we need to use gentamicin. So this is a stronger antibiotics as compared to the others. However, because of also of being strong, it will also have some serious side effects. So we have here also, it is effective for gram-negative bacilli like Pseudomonas aeruginosa, Proteus mirabilis, Escherichia coli, Klebsiella and Klebsiella, Enterobacter, Serratia, and Citrobacter species, and Staphylococci. Okay, so that's a lot of scientific names which are very difficult to pronounce. Okay, so anyway, those gram-negative bacteria, they are causing the diseases that I have mentioned much earlier. Okay, and then we have gentamicin must be transported across the cell membrane in order to enter the cell and disrupt the protein synthesis. Okay, so last time I have shown you a picture or an image of a bacterial cell. So this gentamicin, it needs to go inside the cell. So it needs to penetrate the cell membrane, enter the cell itself, and then it will cause disruption in the protein synthesis. There. So it is also effective in treating meningitis. So again, meningitis, it is the inflammation of the lining of our brain and spinal cord. However, if it is used to treat meningitis, it is administered intrathecally. And I believe you all know what is intrathecally, which is a medication administered through the spine. Okay, there. So there are also some topical preparations, and this topical treatment, it is used for the eyes. It is used also for skin infections caused by susceptible microorganisms, and used also as liposome injection for disseminated Mycobacterium avium-intracellulare, or we call it also as MAC infection. Okay, so Mycobacterium, it is a family of microorganism, and it is closely related with Mycobacterium tuberculosis, or the one that is causing tuberculosis. Okay, so this gentamicin can treat these types of infection. Gentamicin liquid has been successful in bone cement for the management of musculoskeletal infections. Okay, so there is a liquid form of gentamicin, and they are using it for musculoskeletal infections or infections of the bone. So during surgery, sometimes they need to make, or they need to implant a prosthesis. Like for example, there is a broken bone and the bone cannot be replaced. Like for example, in the case of a fractured humerus. Fractured neck of the femur. Okay, so most of the time, this head of the femur will die, and then we need to add a prosthesis. So when we say a prosthesis, it is a false bone, or it is an artificial bone. So in the case of this patient, we are going to use a metal bone, or a metal, and then we are going to place it in place of the bone. Okay, so in order for the doctors to attach the bone, the prosthesis, into the bone, they need a cement. Okay, so this cement, they're going to place some gentamicin. So they're going to place this gentamicin, and then this one will prevent infection from musculoskeletal infections. Okay, so that's another pharmacotherapeutics of gentamicin. So we proceed to pharmacokinetics. So parenteral gentamicin is widely distributed through the body in extracellular fluid, concentrates in the kidneys, and excreted unchanged in the kidney. Okay, so when we say parenteral, of course, it is given through the IV. So administered, and it goes to the different parts of the body. So it focuses on the extracellular fluids, and then it goes into the kidneys and excreted in the urine. So knowing this pharmacokinetics, sometimes it's not necessary for you to know until the end. Like for example, I'm giving my lecture, and then I'm discussing pharmacokinetics. And then I have mentioned here that it is concentrated in the kidney and it is unchanged in the urine. So you can predict that the adverse effect of this medication will also be related to the kidneys. You will also know that the adverse effect of this medication is nephrotoxicity, or it is toxic in the kidneys. Okay? Okay. So I hope you got that. So it crosses also the placenta, and it is secreted in breast milk. Okay. So I am mentioning this in pharmacokinetics. So you should also know that if it crosses the placenta, then it is dangerous for the baby, or for the fetus of the mother. And it is also secreted in breast milk, so it should be used with caution for women who are lactating or who are giving breastfeeding. So sometimes when you study, by simply understanding what is the pharmacotherapeutics, the pharmacokinetics, and the pharmacodynamics, sometimes you will be able to understand already what are the adverse effects, and then what are also the nursing diagnoses, and then what are the health education that you will give your patients. Okay, that's why here in my lectures, supposedly I will be adding the assessment, but I did not already include since it is being repeated in the different areas here, like for example, pharmacotherapeutics or pharmacokinetics. So the main point here is I am reducing the content of my lecture so that it will be easier for you to study. Okay, so oral gentamicin, it is secreted or excreted unchanged in the feces. So most of the medications that are taken orally, and then during the exam they will ask you where is it excreted or where does the medication go out. So usually if it is oral, then it's excreted in the feces. And usually if it is parenteral, it is excreted in the urine. Okay? So it may be given also orally to effect a decrease in the gut gastrointestinal tract flora before colorectal surgical or other invasive procedures. Okay, so for gentamicin, it is poorly absorbed in the gastrointestinal tract. So most of the time, gentamicin is given only parenterally or IV. Okay, but in cases of gastrointestinal surgeries, we can give it also orally. Okay, so because the medications will just be concentrated on the gastrointestinal tract. Okay, so colorectal surgery, it means that there is a surgery which is related to the maybe removal of the colon and the rectum. Okay, so this is in the part of the lower GI. It may also be used topically for infections of the eyes, skin, and the ears. So there are also topical preparations of gentamicin, and they can be used for these skin, eyes, and the ears. So pharmacodynamics, gentamicin, like all antibiotics, has no direct effect on the cells of the body. So that's a good thing. So unlike for our previous discussion that for these chemotherapeutic drugs or the ones we are using for cancer, they are also affecting the cells of the body. So the good thing here in these antibiotics is it does not affect the cells of the body. So our cells will be considered still as normal. So it will only focus on the bacteria. Okay, so it exerts effects by entering the bacterial cell wall. So we have here a picture, and this yellow portion, that is the cell wall of the bacteria. So these events after entering the cell wall, so once our gentamicin already penetrated the cell wall, then the next thing is this event leads to misleading of information used in the cell to form proteins. Okay, so here inside the cell, there's also processing of information, like the cell also has its own brain. Okay, but because of the entry of gentamicin in the cells, it will cause a misreading of information. So it will cause confusion inside the cell. So therefore, the cell produces amino acids that do not link together. So it will just produce its amino acid, and then because of these amino acids that does not link, then the result will be a change in the metabolic function. And then in turn prevents bacterial reproduction, and then it weakens the cell wall, and then leading to cell wall rupture and death. Okay, so it enters the cell again, and then because of the entry, it will destroy the information inside the cell. The cell will produce amino acids which are not relevant, and then there will be a change in metabolic function inside the cells, and then it will stop from multiplying, and then it will weaken the cell wall, and then eventually it will lead to the death of the cell. Okay, so that's how gentamicin would work. Okay, so contraindications and precautions. So as we have mentioned, it crosses the placenta and it is excreted in the breast milk. So it is contraindicated for the pregnant and lactation. Okay, so that's what I have mentioned earlier, that sometimes it is not necessary for you to read until the end of my presentation because you will be able to predict what are the contraindications, what are the adverse effects, and including the health education. Okay. And then known allergy to any aminoglycoside, as we all know, that is always a contraindication. I have made mention last time that if they are asking for contraindications, the first thing that you are going to answer is a known allergy. Okay? Or you can write there hypersensitivity. Okay, so your answer will be 99.9% of the time correct. Okay? Okay, so hopefully you have taken note of that. And it is also used in caution with patients with renal and hepatic disease. So we have mentioned again that these are concentrating in the kidneys and excreted into the urine. And at the same time, we have also mentioned earlier that it is taken orally and it is excreted into the feces. So it will also affect your liver because it is still considered as a metabolic organ. Okay. And then dehydration, pre-existing hearing loss, and myasthenia gravis, as well as in patients receiving other nephrotoxic or ototoxic drug. Okay, so maybe what is not mentioned earlier is about ototoxicity. Okay, so when we say ototoxicity, it will affect your hearing. Okay, so one of the signs of ototoxicity is tinnitus. Okay, tinnitus or ringing in the ear. So what you will hear in your ears is like a consistent something like that. Okay, so if the patient is complaining about that, then that is a sign that the patient is having ototoxicity. Okay, so if the patient is having that sign, then it should be reported to the physician. There. Okay, so adverse effects. The most well-known adverse effect of are neurotoxicity, nephrotoxicity, ototoxicity, and neuromuscular blockade. Okay, so ototoxicity occurs most frequently when serum levels are elevated. So in infants or elderly patients or with prolonged high-dose therapy. So ototoxicity usually occurs during prolonged and high-dose therapy. Okay, always remember that because it is also the same as nephrotoxicity. It is related to prolonged and high doses. Okay. Neuromuscular blockade may result in profound respiratory depression. Okay, so it may affect the respiration of your patient. So therefore, once you are giving gentamicin, always take note to check on the patient's respiratory rate, the pulse rate, or let's say just the vital signs, because it may lead to respiratory depression. Occurs most frequently in patients with myasthenia gravis. So you'll be discussing that disease on second semester. And patients receiving anesthetics. Okay, so general anesthetics, these are medications that are given in the operating room. Okay, general anesthetics. So this will make the patient sleep. Okay. And then leukemoid reactions. So leukemoid reactions, if this is new to you, it means that this is affecting the bone marrow. So we have discussed last time about bone marrow depression. Okay. So functions are potential adverse effect in the hematologic. For GI symptoms, so these are also very common. Once your medication is given orally, most of the time, 99.9% again, your patient will be having adverse effect of nausea, vomiting, and diarrhea. Okay? Because these medications that when you administer orally, it may irritate the gastrointestinal tract. Okay? So once the medication is probably given orally, then you are asked about the adverse effect, automatic answer is nausea, vomiting, and diarrhea. Okay? Okay. So next one will be palpitations, hypotension, hypertension in the cardiovascular system. Hypersensitive reactions like purpura, rash, urticaria, and exfoliating dermatitis will also be there or might be present. And we have super infections, fever, apnea, and joint pain may also occur. So super infections, I will be discussing it in more detail in the later parts of my session for you today. Okay, so drug interactions. So interact with other drugs that are known to be ototoxic, nephrotoxic, and neurotoxic. Okay, so if they are going to ask you about drug interactions, what are the medications that will interact with a certain medication? Okay, so if you already know that these medications are ototoxic, nephrotoxic, or neurotoxic, the drug interactions will be, you're just going to write there medications that are known ototoxic, nephrotoxic, and neurotoxic. Okay? It is not necessary to enumerate all the drugs, but the important thing is you know that if these medications are also toxic in those areas, then you can write them as your answers. Okay? So examples of these medications will be aciclovir, amphotericin, cephalothine, cisplatin, cyclosporin, loop diuretics, nonsteroidal anti-inflammatory drugs, and even vancomycin. So anesthetics, as we have mentioned earlier, that it may interact with this one. So anesthesia, or when the patient goes into the operating room, it is very necessary to note or to tell the doctor that the patient is taking gentamicin, because maybe the drugs will be, or the general anesthesia or the effects of these general anesthesia medications will be decreased. So it's very important to note that. Indomethacin, non-depolarizing skeletal muscle relaxants, and extended penicillins and cephalosporins. So we have there a lot of antibiotics. For the nursing diagnosis and outcomes, we have risk for injury related to potential drug-related allergic reactions or neuromuscular blockade or suppression of the bone marrow function. So the patient will remain free from injury and contact the prescriber if unusual adverse effect occurs. And then since we have diarrhea, so diarrhea related to drug effects, the patient will avoid dehydration, maintain fluid intake, and contact prescriber if diarrhea persists. Okay. And imbalanced nutrition less than body requirements related to drug-induced GI effects or superinfection. Okay. So the patient will be able to maintain body weight and report to the healthcare provider that persistent adverse effects that affect nutritional status. Okay, so those are the main nursing diagnoses that you can have when you are giving the patient gentamicin. Okay, so no need for me to discuss these things, this risk for injury and disturbed perception, because we have already been repeating these things. Okay, so it's up to you to read on this one, because our time is not that long. So maximizing therapeutic effects, we should always give the full course of gentamicin as prescribed at round-the-clock intervals. Okay, so when we are talking about antibiotics, so how will you give the antibiotics? It will be around the clock. Okay, I repeat, always remember that when you are giving antibiotics, one of the most important nursing intervention is for you to give the medication around the clock. So for gentamicin, most of the time they will be administering that every 6 hours. So it will be given most probably 6 o'clock in the morning, and then 12 o'clock in the lunchtime, and then 6 o'clock again in the afternoon, and then 12 o'clock at midnight. Okay? So 6-12, 6-12, all the 6-12s in the whole week, or during the time in which the medication is prescribed, then it should be given 6-12, 6-12, 6-12, 6-12 until it will finish. Okay, so that's one important thing that you should remember. It should be given around the clock. Okay, and then of course it will be full course. So when we say full course, it will depend on the doctor's order. So most of the time, full course will last for an average of 7 days. Okay, so if you are not sure about it, most of the time it will be 7 days, because the average will be starting from 5 to 10 days. So that's the range, but most of the time it's 7 days. Okay, and then also evaluate the culture and sensitivity. So we have mentioned earlier that these medications are more effective for gram-negative bacteria. So once this culture and sensitivity is done by the laboratory, then the results are given to the staff nurse or to the nurse's station. We should make sure that the bacteria causing the disease of the patient is gram negative, or else our medication will be useless. Okay, so evaluate culture and sensitivity reports. So because gentamicin may be inactivate other penicillins, such as carbenicillin or ticarcillin, administer these drugs at least 2 hours apart to ensure efficacy of gentamicin. Okay, so always remember that also. When you are administering 2 types or 3 types of medication, especially antibiotics, they should be spaced with at least 2 hours. So sometimes medications like gentamicin, they will give it at 6 o'clock, and then after 2 hours at 8 o'clock, then they will be administering another type of antibiotics. Because sometimes, like our chemotherapeutic medications, they are also using 2 or more, because we are going after the synergistic effect of these medications. So still minimizing adverse effects, so monitor renal and hepatic functions. Okay, because we have mentioned they are hepatotoxic and nephrotoxic. So it's always nice to monitor the renal and hepatic functions. Assess hydration of the patient and be alert for diluted urine or proteinuria. So the urine should be checked and it should not be diluted, and then there should be no protein. Always remember that the protein is not or should not be present in the urine, because once protein is present in the urine, that's already an abnormality, or most probably an abnormality in the kidneys. Okay, and if there is protein in the urine, most probably the patient's kidney is already affected. Diarrhea may also cause dehydration. And then we can give small frequent feeding, especially if the patient is manifesting some GI symptoms. And frequent oral care and ice chips can be offered to relieve stomatitis and sore mouth. If requires surgery, the chart should be prominently that gentamicin has given. So as I have mentioned, remember that when you're going to bring the patient to the operating room and is taking gentamicin, inform the staff nurse, because it will decrease the capacity of the general anesthetic medication. So what are your health education for the family? So advise female patients not to take this drug if they are pregnant. So of course you already know that. Advise patient to take oral gentamicin on an empty stomach. Okay. So the absorption of gentamicin in the GI is not that great. So the patient should have an empty stomach when taking this medication. Okay, so it should be taken before meals, or 1 to 2 hours or 2 hours after the meal. So instruct patient to take forgotten dose as soon as they remember. Okay. So let's say they forgot to take their medications at 12 o'clock and it's already 1 o'clock. So what should the patient do? The patient should still take the medication at 1 o'clock. However, if the patient forgot the medication and the medication is supposedly at 12 o'clock, but it's already 4 o'clock, so do you think the patient should still take the medications while the next dose is at 6 o'clock? Okay, so if that's the case, then
don't already administer the 4 o'clock dose, or don't administer at 4 o'clock. Instead, administer it already at 6 o'clock and try your best to remember to give the medication. Okay. So instruct the patient to take forgotten doses, as I have mentioned, and notify the prescriber or notify the physician once there are or symptoms do not improve. So when taking antibiotics again, so this is almost a general rule that after 72 hours or after 3 days, then the symptoms should decrease. Like for example, the patient's having fever and it is related to infection. So now antibiotics has been started, and after 3 days the patient still having fever, you should notify your physician because maybe our medication is not acting well on the bacteria, so it should be reported. So the medications should be changed, or the medications should be, or some medications may be added. Okay. And then we have here, teach patients to identify, report, and manage signs and symptoms of allergic reaction and adverse effects. Okay. And then teach patient about ototoxicity. Instruct the patient to take aspirin for headache or muscle pains, because aspirin decreases the potential for gentamicin-induced hearing loss. Okay. So we have mentioned about ototoxicity, and that problem can be managed by aspirin. Okay. And then teach patient about nephrotoxicity, teach patient to how to recognize superinfections, and then avoid contamination of gentamicin eye or ear drops. Okay, so sometimes patients will be administering the medications on their own, especially in the case of eye drops or ear drops. Okay, so always instruct them about the about how clean they should use it. So the tip of the medication should not come in contact with the patient's eyes. Okay, so there should be a distance when the patient is dropping these medications. Okay, so that is all about clindamycin. Okay, so sorry, that's all about gentamicin. So another medication here that acts on the protein synthesis is clindamycin. So they are almost the same. So they belong to like the same family. Like for example, uh, like they belong in one tribe. Like for example, Almokbali, something like that. So they are also closely related. So gentamicin, clindamycin. Okay, so clindamycin. So they are for the pharmacotherapeutics. There's a wide range of aerobic gram-positive cocci and several anaerobic negative and gram-positive microorganisms. Okay, so it says here it can destroy or can kill wide range of microorganisms. Skin and structure infections, respiratory tract infections, septicemia, intra-abdominal infections, osteomyelitis, and prophylaxis for endocarditis. Okay, and then we have in topical form. So when we say topical, these are already in the form of creams. Okay, so it can be applied on the skin. So they are used for acne vulgaris. Okay, so acne vulgaris, I think you're aware about this one. So these are the we call them pimples. Okay, or we call them acne in short. So this commonly occurs when we are teenagers. So when we are a little bit young, our hormones are still having its they are we're still having that inconsistencies in our hormones, and then causing these acne vulgaris to grow. And then sometimes it is also related to poor hygiene. Okay, so your doctor may prescribe topical forms of clindamycin to stop acne vulgaris. So there are also some vaginal preparations so are available for treating bacterial vaginosis. Okay, so there are also some preparations for females which is used for bacterial vaginosis. So pharmacokinetics. So oral absorption is or varies greatly. So depending on the presence of food in the stomach. Okay, so knowing that the absorption varies greatly, then one of your most important intervention here when the patient is taking an oral clindamycin is you should note when is the best time to give the medication, if it is before or if it is after. So in the case of clindamycin, it will be better if we are giving it before meals. So peak levels are achieved in 1 to 2 hours if given orally. If given intramuscularly, the peak levels will be within 20 to 30 minutes. I mean 1 to 3 hours, and it is absorbed within 20 to 30 minutes. While for IV, it is the fastest, so it produces the peak effect within only minutes. And topical clindamycin is only minimally absorbed. So it crosses also the placenta and enters breast milk and the cerebrospinal fluid. So again, since it is crossing the placenta, entering the breast milk, it should be used with caution for the pregnant and the breastfeeding mother. Okay, and then it is metabolized in the liver and it is excreted in the bile and the urine. Therefore, this medication is hepatotoxic and nephrotoxic. Okay, pharmacodynamics, clindamycin is either bacteriostatic and bactericidal. Okay, so we will be using these terms or these two words in the future of this lecture. So I would like to explain bacteriostatic. It means it will only stop the growth of microorganisms. Okay? But for bactericidal, it will directly kill the microorganisms. Okay? So for clindamycin, it is either, sometimes it can only be bacteriostatic. It will prevent only the growth. Or sometimes it will also destroy the bacteria directly. Okay, so it will just depend on the dose. So much lower dose of the medication, it will be bacteriostatic. But if you are going to increase the medication, it will be already bactericidal. Okay, so it will depend on the approach of the doctor if he wants to use it as a bacteriostatic or bactericidal. But in either way, they will also be both very effective. Okay, so sometimes the doctor will just prefer to do bacteriostatic because maybe the patient is suffering from a kidney or a liver disease. So it enters the bacterial cell wall, binds with bacterial ribosomes. So we have here the ribosomes, there, the blue one, the blue dots. And then suppressing protein synthesis and leading to cell death in susceptible bacteria. Okay, so they almost have the same action with gentamicin. So contraindications, pregnancy and lactation, and known allergies. History also of asthma and other allergies, allergy to tartrazine or hepatic or renal dysfunction. Okay, so as I've mentioned, so I will just keep repeating. So once you know the pharmacodynamics and pharmacokinetics of the patient or of the medications, then most probably you will know what are the contraindications, including the other parts of this of the medication, like adverse effect and including the health teachings. There. So history of antibiotic-associated colitis, regional enteritis, and ulcerative colitis. Okay, so those are contraindications. So I would like to emphasize on antibiotic-associated colitis. Okay, so as I have mentioned also earlier about superinfection. So in our GI tract, we have bacteria that are present there. Okay, like for example, your E. coli in the colon, it is normally present there. However, it is not causing problems to the body. So it is a normal occurring flora. Like for example, also our mouth, it is containing fungi like your Candida albicans. Okay, but if we give these medications to the patient, okay, it will destroy the good bacteria of the mouth and the good bacteria of the colon, or in short, the good bacteria in the gastrointestinal tract. And these good bacteria regulate your E. coli. It also regulates your Candida albicans in your mouth. However, if we give these medications, then they are also being destroyed. So what will happen now? It will cause an antibiotic-associated colitis, or it may lead to super infections. So these bacteria that are normally there, which is not doing harm to our body, that's the time that they will grow because the good bacteria is already dead. Okay? So there will be infections in the mouth and we have the Candida albicans. Okay? And then in the abdomen or in the gastrointestinal tract, the patient may have the Clostridium difficile. Okay, so the patient will be having these super infections there. So the most serious adverse effects, that's what I was saying, Pseudomonas membranous colitis, okay, or also known as Clostridium difficile colitis. Okay, so this is the most serious side effect. So the patient will be having diarrhea, abdominal cramps, and abdominal tenderness, and may suggest antibiotic associated colitis. Okay, nausea and vomiting, abdominal pain following oral administration are the most common adverse side effects. So again, if it is an oral form of the medication, abdominal pain, nausea and vomiting, those are the signs and symptoms or adverse effect. It may also affect the blood, having thrombocytopenia, neutropenia, and eosinophilia. Okay, so low eosinophils, low neutrophils, and low platelet count. So adverse effects, still we have sore throat or fever may indicate neutropenia. Okay, so it will be greatly affecting also our blood. So maculopapillary rash, erythema pruritus can develop from systemic or topical use of clindamycin. So these are minor effects of use of topical clindamycin. Pathologic dryness of the skin, or we call it as xeroderma, or there is also dryness of the conjunctiva in the eyes, and we call that as your xerophthalmia, or the drying also of mucous membranes. Okay, so there will be dryness in the skin and including the eyes. Alcohol in some topical formulations may irritate the eyes, mucous membranes, or abraded skin if allowed to come in contact with them. Okay, so as much as possible during these scenarios or during these situations, don't use the alcohol-based swab because these are irritating to the patient's skin. Hypersensitivity may also be an adverse effect. So the most common adverse effect, there. So drug interactions will be neuromuscular blockers. So we have aluminum salts and cyclosporin. Topical preparations containing benzoyl peroxide, tretinoin, salicylic acid, or other topical preparations for acne. Okay, when used with clindamycin preparations can cause cumulative irritant effects leading to excessive drying and peeling of the skin. Because these medications that we have mentioned, like for example tretinoin, they are used for to control also acne, and then they can cause dryness of the skin. So if it's used together with clindamycin, then the patient may be having or may be experiencing a cumulative irritant effect. So patient education should not be taken if the patient already had a reaction to medications that is having or that is ending in mycin. So if the patient is allergic with gentamicin, then most probably he will be also allergic to clindamycin. Okay. Advise patient to contact prescriber immediately if they experience diarrhea, because the most serious side effect again is, we have mentioned, Clostridium difficile colitis. Administer or advise patient to take the medications on an empty stomach because it is absorbed better if we have an empty gastrointestine or we have an empty stomach. Contact the prescriber, so it is the same as gentamicin. And use lotion if skin dryness occurs. There. Okay, so that's clindamycin. The third medication, we have erythromycin. Okay, so again, it is ending in mycin. So therapeutic use or pharmacotherapeutics, it is commonly used in treating Legionnaire's disease. So Legionnaire's disease, it is a type of pneumonia. Okay. So also for mycoplasma pneumonia, and then diphtheria, chlamydial infections, cancroid, and as an alternative, beta-lactam antibiotics in patients who are allergic to penicillin. So we have discussed last time about penicillin, and they are beta-lactam antibiotics because beta-lactams, they are responsible for the creating the cell wall. So once the cell walls are penetrated, then the antibiotic, I mean the bacteria may die. So that's the action of penicillin, if you still remember. So once the patient has allergy to penicillin, the alternative will be erythromycin. So pharmacokinetics, so available or easily activated by the gastric acid. Therefore, several formulations have been developed to overcome this problem. Okay, so it is not the best one to be given orally. So the newest form of oral erythromycin is encapsulated pellets. Okay, so they are already encapsulated so that these medications will not be affected by the gastric acid. Okay, and there are also ophthalmic medications. So ophthalmic, it is placed in the eyes, crosses the placenta and secreted by the breast milk, and then it is metabolized in the liver and excreted in the bile and urine. So these three medications that we have discussed, they have almost the same pharmacokinetics. Also, no direct effect on the body cells. So that's a good one. And then macrolides are bacterial static and bacteriostatic. So almost the same with the three. And then they have the same, we have this one, exerts their effect in inhibiting RNA dependent protein synthesis in the chain elongated step. So this action can prevent the cell from dividing, or it can cause cell death. Okay, so from the three that we have discussed, it is really acting on the protein synthesis of the bacterial cell. So contraindications, allergy, hepatic insufficiency, pregnancy and lactation, and then we have ocular preparations are contraindicated in patients with viral, fungal, and mycobacterial infections of the eye. Okay, so if there is an infection in the eye, it should be noted that it is caused by a bacteria, because if it is viral, if it is fungal, or caused by mycobacteria, this medication erythromycin will not have an effect. Urticaria, maculopapillary rash, pruritus, or we call this in general as allergic reactions. Okay, GI symptoms, and we have hepatotoxicity, and they may also have pseudomembranous colitis. So that's what I have mentioned earlier. Okay, and then the patient may have QT interval prolongation. So it means it may also affect the heart. So the next things that I am going to enumerate are problems in the heart, or I mean in the ECG, like QT interval prolongation, ventricular tachycardia, and then torsade de Pointes type. But that is a French term which is pronounced as torsade de Pointe. Okay, so but it is pronounced as torsades de Pointes. So that is a twisting of the. Anyway, you will see these things if you are going to learn about ECG. So the patient may also experience tinnitus and reversible hearing loss. Okay, so it is also ototoxic. So drug interactions. So we have fatal interaction may occur with astemizole, and we have terfanadine. Okay, so if the patient's taking those two medications, then it should not be used. For the nursing diagnosis, I will just leave this to you, so it will be up to you to read on them. Anyway, it is most of the time repeated, so it's already your responsibility. So maximizing therapeutic effects, reconstitute erythromycin with sterile water only. Okay. So when you say reconstitute, you are going to dilute. So sometimes these medications come in the powder form. So if they are in the powder form, you need to add some sterile water, okay, or you need to dilute. And in the case of erythromycin, the only diluent that you are allowed to use is sterile water. Don't use normal saline or whatever diluent that they are giving you. So only sterile water. And once it is reconstituted, then it must be used only within the 8 hours. Once they are not used after 8 hours, then you are going to discard them. Prepared solution that are refrigerated must be used within 24 hours. And then evaluate culture and sensitivity. So we need to make sure that they are effective in those bacteria. Around the clock, so I have emphasized on that earlier. And then administered at least 1 hour before or 2 hours after meal, because we have mentioned in the pharmacotherapeutics that this medication is easily destroyed by gastric acid. Okay. Okay. So next one is minimizing the adverse effects. So provide small frequent meals, mouth care, ice chips, and if this is for stomatitis and sore mouth problems. Monitor regularly to ensure adequate fluids. Okay, so especially in the case of patient having diarrhea. So administer IV infusions over 30 to 60 minutes. Okay, so this erythromycin should be given at a slower rate. Okay, so most medications, if you are going to administer them in IV, it should be administered slowly. Encourage patients to take complete course of the antibiotics. It should be given around the clock on an empty stomach, and then contact the prescriber if there's no improvement in 3 days. So I think that is no need for me to explain. Those are self-explanatory. Okay, so the next one is tetracyclines. Okay, so tetracyclines are broad-spectrum antibiotics that affect both gram-positive and gram-negative bacteria. Okay, so it has also a wider range. So it can be for gram-positive or gram-negative bacteria. It doesn't matter. Tetracycline can kill them both. Pharmacotherapeutics, so infected by Borrelia burgdorferi. Okay, so it's a little bit difficult, or it's a little bit tricky to pronounce. And we have Rickettsia species, like for example, Rickettsia rickettsii, and then Mycoplasma pneumoniae and Chlamydia trachomatis. Okay, so try to pronounce these names of the bacteria. Okay. Anyway, these bacteria are causing this disease. So brucellosis, cholera, anthrax, Lyme disease, and also for H. pylori infection. So H. pylori infection, these are infections in the gastrointestinal tract. For pharmacokinetics, administer it orally because it is no longer available for parenteral administration. So tetracyclines, they are given in oral form. Okay, so it's no longer available for parenteral. So you will not find tetracyclines that are given IV or IM. So we have absorption takes place mainly on the stomach and the upper intestines. Absorption is decreased in the presence of food, iron preparations, and antacids containing calcium, magnesium, and aluminum salt. Okay, so it says here absorption is decreased in the presence of food. So it should be given if the patient is on an empty stomach. So before meals or 2 hours after the meal. It crosses also the placenta and it is distributed in breast milk. And then tetracyclines is about 65% plasma protein. It undergoes enterohepatic circulation and it is excreted in the feces by the way of the bile. So again, almost the same pharmacokinetics for the medications that we have been discussing today. They are also excreted in the kidney, and about 60% of the dose is excreted unchanged from both routes. For pharmacodynamics, so they are bacteriostatic and they are also bactericidal. Okay, so they retard bacterial growth by inhibiting protein synthesis in sensitive bacteria and by preventing cell division and replication. So pharmacodynamics for the medications that we have previously discussed, they are the same. So contraindications and precautions. So we have first one is allergy, pregnancy, and lactation. And okay, so those are not new. So the new one is used with caution for children younger than 8 years old and in patients with the hepatic and renal dysfunction. So it should be used with caution for children younger than 8 years old. And we have here adverse effects. So GI tract, okay, and the CNS. So the patient may have nausea and vomiting, diarrhea, and rare serious effects include anaphylaxis, angioedema, blood dyscrasias, and damage to the teeth. Okay, so it may damage the teeth of children less than 8 years old. So that's one of the reasons why it should be used with caution. Potential to cause superinfection such as candidiasis. So again, superinfection I have discussed two. First is candidiasis, which commonly occurs in the mouth, and the second one is Clostridium difficile colitis, okay, so which happens in the colon. Okay, so those are the two superinfections that may occur because of these antibiotics. So the effectiveness or drug interactions will be the effectiveness of penicillin G decreases if it is taken concurrently with tetracyclines. Okay, so it should be used, or it should not be used ideally with penicillin G. Oral contraceptives may also have lesser effects. So if the mother does not want to get pregnant and he's taking contraceptive pills, then it may decrease the effect. So forms an insoluble chelate with aluminum, bismuth, calcium, iron, magnesium, zinc, which are frequently ingredient of antacids. So in short, antacids are also drug interactions. So this chelate decreases the absorption of either tetracycline or the salt. Okay, so it should not be given together with antacids. For the nursing diagnosis, I will leave this to you. Anyway, yeah, it is the same. There's nothing new. Risk for injury, diarrhea, impaired skin integrity. So for the maximum therapeutic effects, so we have here evaluate the results of initial culture and sensitivity performed on samples from the infection site. Okay, and then administer as prescribed, divided around the clock. And then oral preparation should be administered on an empty stomach. Avoid antacids within 3 hours of administration. Okay, so we have mentioned that there is a drug interaction with antacids because they may form that chelate. Okay, so if it is really necessary for us to administer antacids, then it should be given within within at least 3 hours after administration. Okay, so for example, you have given tetracyclines at 12 o'clock in 12 o'clock at lunchtime, then the antacid should be given 3 o'clock or 4 o'clock or even 5 or 6. Okay, so there should be at least 3-hour interval. So drug therapy for at least 7 to 10 days. Okay, so as I have mentioned earlier, again, the most common medication or the most common length of the therapy will be 7 days. So here it's 7 to 10 days. Small frequent feedings, no need to discuss again that portion. And then monitor the patient to ensure the adequate fluids are given to replace loss of diarrhea. And we have here photosensitivity. So I will focus on this one because it's new. So photosensitivity, and then there's a need to wear clothing or protective clothing and a sunscreen with minimum of 15 SPF. So I believe you are, especially the ladies, they are aware about this one. So when you are using, when you are going outside, and you don't want your face or your skin to be burned by the sun, okay? So you're going to apply lotion. So when you are going to use these lotions, specifically those who, which are branded or which are considered as a sunscreen, then there will be an SPF, or we call it as your sun protective factor. So the minimum that you are going to use is 15. Okay, so there are a lot of sunscreen lotions nowadays, and they may go as high as 50, 60 SPF. Okay, so it means that they have a they will give you more or a higher protection rate. Okay, so 15 SPF is actually a little bit low. Okay, and especially if your skin is fairer, you will be needing a lotion that is having a higher SPF. But if your skin is darker, then you will be needing also a lower SPF. But anyway, you can use the highest SPF that you want, whether you are fair or not so fair. So caution patients about taking outdated tetracycline. Okay, so once the patient is expired, I'm sorry. Once the medication is expired, then it should not be taken. Okay, because expired medications is ideally not really given. But especially for tetracycline, once they are not or they are already expired, then please do not give it to your patient. So expiration date of this medication is very important. Okay, so providing patient family education. So all that ends with cycline and the patient is allergic to this medication, then please do not administer tetracyclines and should not be taken during pregnancy and breastfeeding, and do not self-medicate. So this is very true for all antibiotics that we will be using. Okay, so do not self-medicate. So it does not mean that when you had an infection and then you have been using tetracyclines, or your doctor ordered tetracyclines, and then now you are having the same infection, it does not mean that tetracyclines will again work. So do not self-medicate. So these medications should be prescribed by the physician. So advise patients to take tetracycline on an empty stomach and with water and not dairy products. Okay, because again, these dairy products are containing calcium and it may lead to chelation. Okay, take OTC medications such as antacids that contain mineral salts. So we have mentioned that earlier. And then advise women to use oral contraceptives to use backup method of contraception while taking tetracycline. So we have mentioned also that it may decrease the action of oral contraceptives. So it is better that the couple or the woman will use, or the male will use, or the husband and wife will use another contraceptive method. So like for instance, they may use, or they may try to use condoms instead of oral contraception. Next one, we have another medication, and it is named as chloramphenicol. Okay, so it has a very good name, chloramphenicol. Okay, so for the pharmacotherapeutics, so this is a true broad spectrum antibiotic. So when we say it's a true broad spectrum, we have been discussing about broad spectrum antibiotics, but still in the book they are defining this as a true broad spectrum. So I believe, or in my understanding, it can kill a lot of microorganisms as compared to the to the different medications that we have discussed in the past. So active against wide range of gram-negative and gram-positive bacteria, many anaerobic bacteria, bacteriode species, and salmonella species. Okay, so those are the microorganisms that this can kill. It is the drug of choice for treating meningitis caused by Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae. It is also used in treating brain abscess, rickettsial infections, and acute typhoid fever. Sorry. Okay. So, for chloramphenicol, when I was a student, this is a very popular drug, and it is used for treating typhoid fever. Okay, because in my country, typhoid fever is a little bit rampant. Okay, so there are a lot of cases there. So usually typhoid fever is very common during rainy days because of the contaminated fluid or contaminated food and contaminated water. So pharmacokinetics, so it is administered orally. So chloramphenicol succinate is administered intravenously. Okay, so it can be administered oral or IV. So rapidly absorbed in the GI. So peak action occurs within 1 to 3 hours for GI absorption. And then the goal is to keep plasma concentration between 25 micrograms to decrease the risk of adverse hematologic reactions. But still until now, I have not seen a patient being monitored of the plasma concentration of chloramphenicol. So I don't believe they will also do this when we are in the hospital, unless maybe it is very necessary, especially for patients who are having liver or kidney disease. So widely distributed in most body tissues and fluids with the highest concentration in the liver and kidneys. It can reach substantial CSF concentrations, especially in patients with inflamed meninges. So as we have mentioned, this is also effective in meningitis. Excreted unchanged in the urine by glomerular filtration. So it can affect also our kidneys. And for pharmacodynamics, usually bacteriostatic, but maybe bactericidal in higher concentrations, or against more susceptible organisms such as Haemophilus influenzae and Staphylococcus pneumoniae. So it will depend on the dose for its action. Like for example, gentamicin, we have mentioned that they may be bacteriostatic or bactericidal. So it depends on the dose. But for chloramphenicol, it may also depends on the microorganism. So in some microorganisms, this medication may act as bacteriostatic, but in some microorganisms, it may also act as bactericidal. So it works by inhibiting the protein synthesis of the bacterial cell wall. So they have the same pharmacodynamics with the previous medications that we have discussed. So contraindications, known toxic reactions. It should not be used for systemic for minor infections because of potential serious toxicity. Okay. So minor infections, it is not advisable. So this is only for major infections. Breastfeeding women, because it can suppress the bone marrow functions of breastfeeding infants. Okay, so this is not a good medication to give for women who are breastfeeding. So it can affect the baby. Patients with depressed bone marrow functions and those who have received cytotoxic drug therapy or radiation therapy. And then extreme caution for the pregnant women and children for hepatic disease, renal impairment, and then we have glucose 6-phosphate dehydrogenase deficiency, or we call it in short as G6PD, and acute intermittent porphyria. And then adverse effect may have life-threatening adverse effect. That's why it's not given to babies or to infants, because it may lead to gray baby syndrome. Okay, so for gray baby, it is literally the patient or the baby will having a color which is colored grayish. Okay, so this is because it will affect the blood of the baby. Okay, so because of poor oxygenation, because of altered blood components, then the baby's color might be affected. And this is a serious and it is a life-threatening complication or adverse effect of chloramphenicol. It may affect the blood. Okay, so it can include aplastic anemia, hypoplastic anemia, thrombocytopenia, pancytopenia, and granulocytopenia. Okay, so it will affect the platelets. And optic neuritis, okay, so it can affect also the eyes. So it can lead to blindness. Neurotoxicity may include the headache, mild depression, confusion, and delirium. It may also affect the GI, skin. In the topical use, it can cause pruritus, burning sensation, vesicular dermatitis, and maculopapillary rash. Okay, so there are really some serious adverse effects of this medication. That's why, as much as possible, it should not be used for non-serious infections. And for drug interactions, there are many types of interactions or many drugs, and then you can always check it in your books. Okay, so you can check them on the table 40.14. Okay, because there are really a lot and it's very difficult for me to copy. But anyway, in case you will be asked about the drug interactions for chloramphenicol, you can just write there if they are uh, neurotoxic, nephrotoxic, and still you can write there ototoxic because it can affect these different systems in the body. And for the nursing diagnosis, risk for injury, no need to discuss. Risk for impaired skin integrity. So I think those are already discussed in the past and no need for me to repeat. Am I correct? Anybody still there?
Yes.
Okay, so I'm happy that still somebody is listening to me. Okay, so we are almost, I think we have reached almost half of the session. Okay, so just relax there. You can take your coffee, you can take your bread or whatever you want. Just relax and just listen to me and try to understand what I am saying. Okay, so far I'm not having problem with my audio, with my sound.
No, no.
Okay. Okay, so maximizing therapeutic effects. So it is administered on an empty stomach. So again, so most of these medications that we have been discussing today, it should be given on an empty stomach, because if the patient is having food in the stomach, what will happen? It may decrease the absorption of these medications. So for patients with GI distress, chloramphenicol may be administered with meals. Okay. So if the patient is having GI distress like vomiting, nausea, when he's taking these medications, then it may be administered with meals. And then monitoring plasma concentrations at least weekly or more often in patients with hepatic or renal impairment. And peak levels should be in the range of 10 to 20 micrograms per liter. So as I have mentioned earlier, that we are going to monitor the levels of chloramphenicol in the body. So however, this is only for patients with hepatic and renal impairment. But most of the time, doctors would rather prescribe another medication than risking the patient's hepatic and renal impairment. So sometimes they don't do this one to be on the safe side. Avoid IM injections because they may cause bleeding, bruising, and hematomas. So this is not typically administered IM. So usually it is only administered IV. Explain the importance of completing the therapy. Point out the potential adverse effect and need for periodic blood monitoring and daily assessment. Teach patient the importance of measuring the fluid intake and output accurately. And then advise to report symptoms to the healthcare immediately. So measuring intake and output. I believe you know this one. Okay. Anyway, it will be explained in your I think in your laboratory sessions that you need to monitor the intake and output. So for the meantime, we don't have enough time. I will not be discussing that. Okay, and the next medication now is mupirocin. So mupirocin, it is a topical antibiotic used to treat impetigo and other minor skin infections due to Staphylococcus aureus or Streptococcus pyogenes. Okay, So mupirocin. So you will commonly see this in the male medical ward. So this is only a topical antibiotic, which means that this is coming in the form of a cream. Okay, so mupirocin is also approved for nasal decolonization of methicillin-resistant Staphylococcus aureus, or MRSA. So it can be used in nasal decolonization or in the nose. So the action of this is it inhibits bacterial growth by disrupting again the protein synthesis. So we are still on the medications that is disrupting the protein synthesis of this organism. And then more severe infections require oral antibiotic. However, the disadvantage of mupirocin is it is only used for less serious skin infections. But if the skin infection is a little bit severe, then we are going to advise the patient to use other, or the doctor should prescribe medications that are a little bit stronger. So not already mupirocin. Okay, so those are the medications or the drugs that is affecting on protein synthesis. So we have the miscellaneous drugs. So the first one is ciprofloxacin. So one of the medications that is also commonly prescribed in the male medical ward. So for pharmacotherapeutics, this is most active against aerobic gram-negative microorganisms and group D staphylococci. Okay, so they are a little bit more specific as compared to our antibiotics that we have discussed. Used extensively to treat serious gram-negative infections, urinary tract and upper and lower respiratory tract, gonorrhea, infections in the bone, skin, subcutaneous tissues, and joints, bacterial conjunctivitis, and otitis externa. Okay, otitis externa is an infection in the ears. Treatment of and prophylaxis against anthrax and for the treatment of typhoid fever. So this is the second time that we have mentioned typhoid fever. So first one is in chloramphenicol, and also it can be treated by ciprofloxacin. For the pharmacokinetics, so available in oral, parenteral, and topical formulation. So it is complete. So you can give it orally, can give it parenterally or IV, and it also has a cream form. So for topical formulations, it include both otic and ophthalmic preparation. So we have, when we say otic, it is placed in the ears, and for ophthalmic, it is placed or it is used in the eyes. So some medications, they can be used both otic and optic, but some medications, they are specifically prepared for ears, and some are specifically prepared for the eyes. Okay, so you should read the label before you administer. If it is ophthalmic medication, use it also only for the eyes and don't use it for the ears, and vice versa. Absorb rapidly in the gastrointestinal tract and undergo minimal first pass metabolism. So it is distributed into most tissues because protein binding is low. Ciprofloxacin is eliminated through the renal and the feces. And IV ciprofloxacin has an onset action within 10 minutes and peak effects within 30 minutes. So topical ciprofloxacin has an onset of 5 minutes. Okay, so that is the pharmacokinetics. Okay, so always that if it is IV, always remember that the action is within minutes. It has a very fast absorption rate. But for oral, usually it will take hours. So in the average, if you are being asked about pharmacokinetics and about how much time is the medication absorbed, then for IV, usually if you can have an answer of less than 10 minutes, then it is most of the time correct. For oral, usually it will be absorbed within 1 to 2 hours. Pharmacodynamics, so acts on the bacterial cell wall. So it is almost the same as penicillin and the other medications that we have discussed last time. It is also bactericidal, so it inhibits the deoxyribonucleic acid or the DNA. So an enzyme for bacterial DNA replication. So it acts on the DNA gyrase, okay? So it destroys the replication of the DNA. Or when we say replication, it means replication, it will create another DNA, okay? So it will not be creating another one. So organisms may not resume growing for 2 to 6 hours after exposure. So usually bacteria will grow at a faster rate, but when you administer this medication to the patient, then they will not grow within for 2 to 6 hours. And then because of these 2 to 6 hours of not growing, they may die. Next one is concentrated within human neutrophils, which may explain the effectiveness in treatment of mycobacterial infections. Contraindication is for the pregnant and lactating and allergy to fluoroquinolone. Okay, so fluoroquinolone medications should not be given together with this medication. Children younger than 18 years old with exemption to complicated UTI and treatment of anthrax. So this should only be given to adults. So it should be used with caution if your patient is 18 years old or younger. So GI disease, so diabetes mellitus, renal disease, hepatic dysfunction, and in patients with dehydrated and those receiving warfarin. So CNS disorders also, like for example, the patients having a seizure disorder, cerebrovascular disease, like for example, cerebral arteriosclerosis. So those are the contraindications and precautions. So adverse effects, we have arthropathy. So this is a disease of the joints. Tendinitis and tendon rupture may also be an adverse effect. Pseudomonas colitis, superinfection, hepatotoxicity, nephrotoxicity, myelosuppression. Myelosuppression, it is a bone marrow suppression, okay? So it is the same. And peripheral neuropathy. So GI effects. And then the patient may also have CNS reactions like headache, restlessness, dizziness, vertigo, insomnia, nightmares, and others. Okay, so if you are being asked about the adverse effects, you can write there the CNS reaction, and then you can just give one or two examples, like maybe headache and dizziness, or you can go directly headache, dizziness as your answer. Okay. And then for the cardiovascular system, it may also affect, like the patient may have palpitations, atrial flutter, premature ventricular contractions, syncope, angina, myocardial infarction, cardiac arrest, and cerebral thrombosis. The patient may also have photosensitivity, and we have here a new word, dysglycemia. Okay, so I believe this is your first time to hear this word, but if not, you are lucky. Okay, so when you say dysglycemia, it means it may cause hyperglycemia or hypoglycemia. So this the effect of this one is unpredictable. So it may raise the blood sugar, or it may also decrease their blood sugar. That's why ideally this is not given for patients with diabetes. Okay, so ciprofloxacin is not ideal for diabetic patients. So usually they are associated with local effects such as burning or local discomfort, lid margin crusting, crystal scales, foreign body sensation, pruritus, conjunctival hyperthermia, hyperemia, and a bad taste following administration. So this is for ophthalmic medication. So if this is given through the eyes. Okay, so drug interactions will be warfarin. We have siphonylurias. Okay, so it may, because this may cause hypoglycemia, and we have cyclosporin. So increasing that, because we are increasing the risk for nephrotoxicity. Okay. So those are the interactions for that medication. And may I take a look at this nursing diagnosis? I believe they are also explained last time. Okay. So no need for me to discuss, and we proceed to maximizing therapeutic effects. So it is the same, administer in full course, and it should be around the clock. And then the same thing again, review culture and sensitivity. So you will always be having an answer if you will be asked about maximizing therapeutic effects. Again, it should be given full course and round the clock, and review culture and sensitivity. Okay? That is a very basic thing there in maximizing therapeutic effects. If you will know that, you will always have an answer for maximizing therapeutic effects of these antibiotics. And minimizing adverse effects will be small frequent feedings, and then safety measures for CNS effects, especially if the patient's having dizziness. Okay, so like for example, the patient has taken this medication and then he is due for discharge. So you should ask the patient if he is driving or not. Okay, because maybe your patient is discharged, he has taken this medication and then went to drive, and then suddenly while he's driving, he felt dizzy, and then the car has crashed, and it will create another problem with the patient. So always think about the safety measures if the medication is having a CNS effect. Next one, frequent mouth care for stomatitis. And for education, so since we are giving ciprofloxacin, so all medications, or if the patient is having allergy to medications ending in oxacillin, then we should not give this medication. So it is not also used to self-medicate. Okay, so these are also being repeated. So just take note of these things that is being repeated. So when you will be asked in the exam, you know what to answer. So not to be used for self-medication. Call the prescriber if symptoms does not improve in 3 days, full course therapy. So advise patient to take ciprofloxacin every 12 hours. So ciprofloxacin, usually it is given every 12 hours. So the good thing in giving it every 12 hours is it will be at the same time. So if it is prescribed 8 o'clock in the morning, okay, so if it is every 12 hours, the patient will be taking only this medication at 8 morning, 8 nighttime, 8 morning, 8 nighttime. Okay, so that's how we administer ciprofloxacin. It should be, or most of the time, it is prescribed every 12 hours. Tell patients to report tendon pain, because we have mentioned that it may cause arthropathy or disease in the joints. Okay, so it should be reported if the patient is having a problem on the joint. Okay, so we are almost there. So drugs used to treat urinary tract infections, okay, or UTI. So we have, first one here is sulfonamide. So the mainstay of the treatment of UTI for many years. So this is once the patient's having UTI, their mainstay or the number one treatment that they are using is sulfonamides. So category of short acting, intermediate acting, topical, and long acting. So we have sulfa methoxazole, okay, or in short we call it SMZ. Okay, so it's an intermediate acting sulfonamide, and it is only available in the United States in combination with the drug trimethoprim. That's why the combination of these two drugs, we call it as SMZ TMP. Okay, so this is in short for sulfametazole and trimethoprim. Okay, SMZ TMP. Okay. So for the pharmacotherapeutics, we have the brand name, which is a very common one, is cotrimoxazole. Okay, so we also have Bactrim DS, and we have Septra DS. So has a broad spectrum range of therapeutic uses. Okay, but the most common here that I have learned, or I have seen in the Philippines and until here in Oman, is cotrimoxazole. So it is used in uncomplicated UTIs and systemic infections caused by susceptible microorganisms. So these are the first line of medications used to treat UTIs. And in case this cotrimoxazole or this medication does not work, then that's the time that we are going to prescribe the medications that we have discussed earlier, like gentamicin, erythromycin, clindamycin, chloramphenicol. Okay? But if not, then we use with this SMZ TMP. And use also for respiratory infections caused by Haemophilus influenzae and Streptococcus pneumoniae, Legionella pneumophilia, pneumonia, or we have mentioned earlier about Legionnaire's disease. So gastrointestinal infections, including shigellosis and salmonella infections. So pharmacotherapeutics still concentrates in the prostate and vaginal fluids. So this makes it effective for UTI because it is concentrating in the prostate and the vaginal fluids. So it is really, really very effective in treating urinary tract infections. It is also effective for the treatment of sexually transmitted disease, like in the cases of acute gonococcal urethritis and oropharyngeal gonorrhea. Okay, so these are sexually transmitted diseases. May be used for skin and structure community acquired MRSA. Anyway, you will be understanding more on MRSA in the future. For patients also with HIV, this medication is used for prophylaxis of pneumocystis jirovecii. Okay, so this is formerly known as pneumocystic carinii. Okay, so that's the old name. So now it is called pneumocystic jirovecii pneumonia and toxoplasmosis encephalitis. So that's for HIV cases. So pharmacokinetics, it is absorbed following oral administration. So these are given mostly in oral forms. So metabolized in the liver and it is excreted in the urine. So peak plasma levels usually occurs at 4 hours. So it is a little bit longer. While for IV administration, it peaks approximately in 1 hour. So it is also a little bit longer as compared to other IV medications. Well distributed throughout the body and crosses the blood-brain barrier and placenta, and it is excreted again in the breast milk. Inhibits microorganisms by interfering with the synthesis of tetrahydrofolic acid, okay, or THF. So reduces the availability of tetrahydrofolic acid, and then it inhibits thymidine synthesis and subsequently DNA synthesis. Okay, so the pharmacodynamics is a little bit complicated. However, it will also affect the DNA synthesis of these microorganisms, and then it will be causing the bacteriostatic effect or bactericidal effect. Although TMP and SMX are weak bactericidal agents, when given alone, the combination is highly bactericidal. Okay, so it is better if these two medications are combined together. That's why SMP, SMX, TMP is a good combination. So if they are working just alone, it is not good. But if they are given in combination, they are functioning at their best. Contraindications and precautions. So hypersensitivity, and then patients also with G6PD, and then hepatic and renal, and also use in pregnant women and also children younger than 2 months. So it should not be given for a very young infant. Okay, so except in treating congenital toxoplasmosis, so that is the only exemption to by giving this medication to 2-month-old babies. Adverse effects, we have well tolerated in routine use. Okay, so when you say well tolerated, most of the time patients will not feel any adverse effect at all. Okay, so it is well tolerated. However, it may lead to nausea, vomiting, and diarrhea. And then it may lead also to some allergic reactions. And we have here the word crystalluria. Okay, so crystalluria, this is the formation of crystals in the urine. Okay, so it is sometimes this will be a painful, it may lead or it may cause painful urinations. There, crystalluria. So results in severe renal damage. So to avoid crystalluria, patients should be instructed to maintain hydration by at least 1.5 liters of water per day. Okay, so increasing fluid intake will prevent crystalluria. Okay, and I think this one. So Steven-Johnson syndrome. This is the one of the severe reactions that can be caused by this medication. So drug interactions will be oral hypoglycemics. We have phenytoin, oral anticoagulants, and anti-neoplastic drug methotrexate. Okay, so anti-hypoglycemics. So these are medications taken by patients with diabetes. Okay, phenytoin, this is an anti-seizure. Oral anticoagulants like heparin. And we have anti-neoplastic agent, or this, when you say anti-neoplastic agent, it is a chemotherapeutic drug. So I hope you still remember methotrexate. Local anesthetics such as procaine are derived from PABA. So not also good when it is combined with local anesthesia like procaine. Foods that can acidify urine, such as cranberry, should be avoided. Okay. So they should not be taken with cranberry juice or anything that acidifies the urine. When urine pH falls, sulfonamides may precipitate and cause crystalluria. Okay, so as much as possible, don't drink these juices when taking this medication. So for the nursing interventions, we have pain. I think we have been discussing that over and over. Risk for injury is the other one. So maximizing effect, administered 1 hour before or 2 hours after meal with full glass of water. And then patients who are experiencing GI effects may take drugs with food. Minimizing the effects will be increasing the fluid intake, and then encourage patients to take precautions before sun exposure. And IV route, infuse the drug slowly for over 60 to 90 minutes. Okay, so it is very common here. Once it is given in IV, it should be, the minimum is 30 minutes. I have never seen yet an IV here that is saying that it should be given less than 30 minutes. So it should be given over 30 minutes. But in the case of this medication, it is over 60 to 90 minutes. So another medication that is used for urinary tract infection is nitrofurantoin. So nitrofurantoin with the following brands: furadantine, macrodantine, and macrobid. So it's another synthetic urinary tract antiseptic. So this is the second medication. So it works by interfering with several bacterial enzyme system. So it is highly effective in gram-negative and gram-positive organisms in the urinary system because high concentrations are found in the urine. So contraindicated for patients with renal impairment in infants younger than 1 month because possibility of hemolytic anemia and pregnant women at term. So when you say pregnant women at term, is they are almost ready to deliver the baby. So most probably around 7, 8, or 9 months. Achieves in high concentration in urine but low concentration in the blood. Okay, that's why it's better for UTI because higher concentration in urine as compared to the blood. So in the presence of kidney dysfunction, its concentration in urine decreases and increases concentration in the blood increases. Okay. So not that much to discuss here because they are almost the same with the different bacteria antibiotics that we have discussed. So it is pregnancy category B. So it is, since it is category B, it's a little bit safer as compared to the other antibiotics. However, the one thing here is it can induce asthma attack in patients with history of asthma. Peripheral neuropathy is one of the most serious toxic effects, and acute reactions are manifested by fever, chills, myalgias, and dyspnea. Subacute pulmonary reactions develop over time with many symptoms, however, diffuse. Interstitial pulmonary fibrosis may also be irreversible. So that's a bad effect here because it is irreversible. So it means that once you are having this pulmonary fibrosis, sometimes it cannot be reversed or it cannot go back to normal. Okay, and in the final minutes of my lecture, it is all about the medications that is used for mycobacterial infections. So mycobacterial infections, these are mostly, or one of the most common is tuberculosis. So here in Oman, we still have cases of tuberculosis. So we need really to discuss these things because these are the medications that we are going to use if we are going to treat patients with TB or tuberculosis. So we are having five medications currently used, but we will only be discussing four because the fifth one is streptomycin, but it's not included here. So the first one is isoniazid. So isoniazid, it is pharmacotherapeutics, and it is an antibacterial used for the treatment of tuberculosis and susceptible mycobacterium infections. So it can also destroy the microbacterium organisms like avium, bovis, intracellulare. We have Kansasi and Zulgai. I'm not sure about this. I'm not sure about the pronunciation of this one. And we have Cenopi or Cenopi. I don't know. So pharmacotherapeutics, isoniazid is administered orally or intramuscularly, and it is absorbed in the GI with peak serum levels attaining within 12 hours. But mostly these medications for mycobacterium, it is taken orally. So it crosses the placenta and distributed into the breast milk, metabolized in the liver, and excreted in the urine, and also excreted in the feces, saliva, and the sputum. So it is both bacteriostatic and bactericidal. So works by disrupting the synthesis of bacterial cell wall. So this medication acts on the cell wall. So adverse effects after ingesting tyramine containing food. So this is, I think, new. Tyramine, like examples would be chocolate. We have dairy products. Okay, so those are the two common sources of tyramine foods. Okay, so contraindications and precautions: hepatic and severe renal impairment, DM, malnutrition, alcoholism, pyridoxine, can cause peripheral neuropathy. And then this is a pregnancy category C drug. So, however, pregnancy category D, but it is it says here it is safe for lactation. So for people giving breast milk or breastfeeding, it's okay. Next one, for the adverse effect, it is hepatotoxic. It may also lead to peripheral neuropathy, encephalopathy, and then it can also lead to endocrine changes like hyperglycemia, metabolic acidosis, gynecomastia. So gynecomastia, this is occurring in this may happen in males that their chest may grow like a breast. Okay, so enlargement of the chest. So cause hypocalcemia also and hypophosphatemia. Okay, so it increases the calcium and the phosphate in the blood. And GI, hematologic and integumentary systems, interstitial nephritis, CNS toxicity, and it may result in seizures. So drug interactions, we have carbamazepine, I should say, alcohol, aluminum-based antacids, benzodiazepines, disulfiram, enflurane, ketoconazole, meperidine, warfarin, and rifampin. So that's a lot of drug interaction there. So INH has also with the monoamase inhibitors, or we call them as the MAWIs. So interacts may occur with the tyramine containing food. So as we have mentioned, chocolates and dairy products are the most common source of tyramine. INH may also interact with foods containing histamine. No need for me to discuss those things. And for maximizing the effects, it should also be on an empty stomach, and it may be taken with meals if there is a GI distress. Maximizing effects or minimizing effects will be reporting signs and symptoms and reporting burning pain in the extremities, and discontinue if hepatitis or there is an elevation of the LFT. So I believe we have the same patient education, except here that we are emphasizing more on alcohol and tyramine or histamine rich foods. The second one is to treat mycobacterium is ethambutol. So ethambutol is more effective and less toxic than other anti-tubercular agents. Okay, so more effective and less toxic. So we can use this one. So it works by inhibiting the synthesis of certain metabolites with subsequent impairment of cell metabolism leading to cell death. So that's how ethambutol would work. So it affects against INH and rifampicin cell bacilli. So we have the so-called resistant or drug resistant. So sometimes we are using isoniazid, and then the patient is taking isoniazid. However, he forgot to take the medication for 1 day. So because of the bacteriostatic effect only, and then after some time, the bacteria will grow. And then you are going to administer still isoniazid, what will happen? The bacteria will cause resistance. So in short, it will try to, or it can already survive even if we are giving this antibiotic. So if the patient has developed a resistance on isoniazid or rifampicin, then we can give ethambutol. Okay, so widely distributed drug, it reaches higher concentration kidneys, lungs, and the saliva. So it crosses also the placenta and is distributed to the breast milk, but there is no adverse effect for the infant. So ethambutol is really a friendly drug friendly drug to treat tuberculosis. Not recommended for age under 13. One of the main adverse effect is optic neuritis. It is hepatotoxic, and it is also hyperuricemia. Therefore, we should check for the history of gout. Okay, so that's ethambutol. And another one is the pyrazinamide. So more effective and less toxic as compared to other anti-tubercular drugs. So it is almost the same as ethambutol. So it is indicated only for treating Mycobacterium tuberculosis. So pyrazinamide, once you hear that the patient is taking this medication, you know that the patient's having TB or tuberculosis. The exact mechanism is not known. However, it exhibits bactericidal action. So we don't know how it affects, but if it is given to the patient, it kills the bacteria. So that's it. Pyrazinamide is administered orally, metabolized into active metabolites, excreted in the urine, primarily by way of glomerular filtration. So it is widely distributed in the inflamed meninges. So given cautiously to patients who are pregnant, if there is a history of alcoholism, gout, and hepatic disease, because this is considered as hepatotoxic. So it can also cause arthralgias. And then baseline laboratory tests including complete blood count or CBC, liver and renal function tests, and uric acid level should be taken before starting this medication. Okay. And the last medication for today is rifampin, or sometimes we call it as rifampicin. Okay. So for the pharmacotherapeutics, so it is one of the first line drugs to be used in treating tuberculosis. So honestly, I have taken these medications when I was young. because I was infected with Mycobacterium tuberculosis, but we don't call it tuberculosis if you are younger or you are a child, but we call it as a primary complex. So when I was diagnosed before of primary complex, my doctor prescribed me with rifampin. So as we have mentioned, this is the first line. So they should start with rifampin before starting with the other medications. So this is also not only used for TB, but it is also used for meningococcal infectious disease, and it is also the primary drug for leprosy. So leprosy, it is also another disease that primarily affects the skin. Okay, so most of the signs and symptoms for leprosy is the skin. So leprosy is one of the oldest diseases, and I'm not sure if it is. I think if it may be written, maybe this disease is in the Quran, or this disease is like, for example, in the case of the Bible, it is written there. So one of the oldest diseases. Okay, so mycobacterium infections. Pharmacokinetics, it can be administered orally or parenterally, but most of the time it is given orally. So it is well absorbed in the GI except in the presence of food, so which decrease both the rate and extent of absorption. So again, most of the medications that we have here, it is not well absorbed with food. Okay, so most of these antibiotics that we are giving, it should be given before meals or 2 hours after the meal. Rifampin is widely used, distributed to the body tissues, fluid including the CSF, and concentrates intracellularly primarily on the leukocytes. Metabolized in the liver to an active metabolite and undergoes enterohepatic circulation with substantial reabsorption. So excreted primarily through the biliary elimination in the feces. Okay, so it is metabolized in the liver, and then it goes out through the feces. So pharmacodynamics works by blocking the initiation of RNA replication by inhibiting bacterial DNA-dependent RNA polymerase. In short, it acts in the RNA. Most of the medications that we have discussed, or some of the medications we have discussed, they are acting on the DNA. But for rifampicin, it is acting on the RNA. So both bactericidal and bacteriostatic also, and it does not bind to RNA polymerase in human cells. Thus, RNA synthesis in the host is not affected. Okay, so it is only affecting the RNA of the bacteria. But for the RNA of the human cells, they are not accepted, or they are not being affected. So this is a very friendly drug for us. For contraindications, no need for me to identify hypersensitivity. Contraindicated in sulfite hypersensitive patients. Okay, and contraindicated in patients taking non-nucleoside reverse transcriptase inhibitors, or NNRTIs. So these medications are considered as a psychiatric medication. So this is for treatment of patients with psychiatric problems. Okay, so NNRTIs, or non-nucleoside reverse transcriptase inhibitors. Hepatic dysfunctions in patients known to have alcoholism. So if the patient has been an alcoholic, this medication is not ideal for him. Rifampin may cause adverse effects similar to INH. Okay, so adverse effects similar or the same as INH or isoniazid. Discolor body fluids such as urine, saliva, tears, and sputum. Okay, so this happened to me. So when I was taking rifampicin before, and I pass urine, and my urine color is orange. Okay, so it can discolor the body fluid. So mostly orange in color. So you may have your urine is orange, your saliva is orange. When you cry, it's orange. Okay, so it's pretty cool to have an orange tears, crying, and it's orange. Okay. Wearers of soft contact lenses should be cautioned that contact lenses may be permanently discolored. Okay, so if you are having eye problems and then you're using contact lens, and since we have mentioned that including the tears, it may cause discoloration. So during this time, you should consult your ophthalmologist, and then maybe not to use for the meantime contact lenses, but you are going to use glasses, okay, because it may interfere with the contact lens. So adverse effects also: GI disturbance, headache, drowsiness, fatigue, and dizziness, and including rash. And for the drug interaction, is a potent inducer of cytochrome P450. It is a hepatic enzyme. So all medications that are hepatotoxic, it should not be given or should be used with caution when administering rifampicin or rifampin. Nursing diagnosis: risk for injury, and we have imbalanced nutrition, and we have ineffective protection. So I guess the ineffective protection is new. So it is related to blood dyscrasias. So when you say blood dyscrasias, it may affect your red blood cells, white blood cells, neutrophils, and other blood components. Okay. So ineffective protection, like for example, thrombocytopenia, you don't have enough platelets. So what will happen? You are at risk for bleeding, because as we all know, our blood is our secondary protection. Our primary protection will be the skin. So once your skin is intact and then your blood is having problems, then it may also be considered as ineffective protection. So patient will remain free without injury all throughout the therapy. Maximizing side effects: so administer IV slowly but infusions over 2 hours. So I think this is the longest IV infusion that we can give if we are administering rifampin. So it should be over 2 hours. For the previous medications that we have discussed, we are administering it 30, 60, or 90 minutes. But for rifampicin, we should administer it over 2 hours. So oral rifampicin should be given 1 hour before or 2 hours after meal. Okay, so that's, I think, pretty standard. So promote adherence to oral rifampin therapy. Okay, so oral rifampin therapy, it is not only given for 7 days. So usually it will take months. So it may take 3 to 6 months. So during my case, when I was taking this medication, I have been taking it for 3 months. I was reassessed by my doctor, and then it was extended for another 3 months. So in total, I have been taking this medication for 6 long months. So minimizing adverse effects: assess patients taking hepatotoxic drugs such as INH, PZA carefully, because the risk of hepatotoxic is increased. So if the patient is taking isoniazid and pyrazinamide, it should be used with caution when we are giving rifampicin. And for the patient education, finally, the last part, explaining the potential effect of rifampicin on the liver. And then I have mentioned earlier about the ophthalmologist, and then you should change your contact lenses to glass. Okay, and then assure patients that the discoloration of the fluids is not harmful. Again, we have mentioned that there will be an orange discoloration of the urine, saliva, tears, and other body fluids, and this is not harmful for the patient. So another method of birth control while taking rifampin. So when the patient is taking this medication, the couple should be using another birth control method, because the oral contraceptive pills might not be effective. Explain the importance of taking the medication consistently, even though the patient will not feel different. Okay, so even if the patient is feeling that his condition has improved, then still the patient should complete the therapy. So if it is prescribed for 3 months and he's feeling better at the first month, still the patient should be completed in 3 months. Okay, that's it? Yeah, I think so. I think we're done. Okay, so any questions? It's 12:06.
No, Master.
So exactly we finished in 59 minutes, correct? Because we started at 10:07, if my memory is still right. Okay, so do you have any questions from our discussion, from our topic? So these are the
No.
medications that we have discussed. So we have discussed the medications that is affecting the protein synthesis of the bacterial cells. We have discussed also the medications which is used for treating urinary tract infection, and we have also discussed the medications used to treat tuberculosis. Am I correct? Yes or yes?
Yes.
Yes. Okay. So thank you for being with me. It's already 12:07, so I'm going to end my lecture now. If you don't have any questions, anyway, in case you have any questions, you know my WhatsApp number. You can always contact me there, or you can send through Edmodo, or whichever method you are comfortable. Okay, so have a nice day, and I hope to see you all on Wednesday. So I will be having again another session with you on Wednesday. So it will be about antifungal medications. Okay?
Okay.
Okay. So thank you very much, and I hope all of you will be having a good day ahead, and enjoy your lunch.
Yeah.
Okay. Bye and see you.
Bye.
Okay. See you.